Welcome back to the channel and welcome back to beautiful Chiang Mai. So I'm coming to you from Suk Vineyard. It's a nice cafe. I just had the most amazing crab fried rice. I had a nice Thai tea, and I thought this would be a good day to do a video. So a lot of you have asked me about my insurance journey and how I got my health insurance. Well, in this video, I'm going to talk about just that. I'm also going to talk about why I feel it's important to also get travel insurance if you're just coming over here to visit. Why I believe that not getting insurance can be very dangerous. Why it can be too late, depending on when you come over here, if you come over here to live full time. And hopefully this will answer some of your questions and just an overview of my health insurance journey. And I'm sure there'll be some nuggets in there for you to pick up. So when we decided to come over here, I decided to get travel insurance, and I will tell you why. My journey into travel happened a little later in life. I was in my late 20s when I started traveling. Before it was just get on a cruise ship, go to the Bahamas from Florida. That was pretty much it. But when I started traveling, I started to see some things. And even though I was, late 20s, early 30s, I remember being in this one resort, all-inclusive resort in Jamaica. And I'm at the piano bar, and this guy gets up on the piano bar. You're doing sing-alongs, and he has the microphone. He's standing on the piano, and I watch as he fell, and he hit his head on one of the tables, and he was out cold. And they transported him away. Well, that struck something in the back of my head, but it really didn't stick. And then I had another incident where I was at a resort where a guy had what appeared to be a seizure, and he was actually flown out back to Florida for treatment. And so when we think of travel, we think of just going somewhere, having a good time, but we never thought about the things that can happen. So if you go back and you look at my video, Don't Die in Chiang Mai, I'll put it up here somewhere. And I talk about the accidents that happen, how many people end up hospitalized in these accidents, these motorbike accidents over here in Thailand. Now, as a tourist, you come over here. Imagine this. Imagine you're just on your motorbike, you know what you're doing, but you have people coming the wrong way. It happens all the time. And there's a car accident. And here you are, you're in the hospital. Does your insurance from your other company, from your other country, does it cover you being hospitalized? That's one of the questions that you have to ask yourself. And not only that, I recently read an article. It is currently the rainy season over here, and I love hiking, but I had a friend of mine from pickleball say you do not want to hike during the rainy season. He says that's when all the venomous snakes come out and it can be very dangerous. So I looked it up, and he was right. I want to say in 2023 there was over 12,000 incidents of people responding to the hospital during rainy season for snake bites and other, I guess, dangerous animal bites. And so anything can happen. You come over here, you can go on a hike, you can get bit. I think I'm pronouncing it right. Dengue fever is up 1/3 more in the rainy season also, and that is something that can put you in the hospital. So I personally, I would not travel here or pretty much anywhere unless you have travel insurance. I'll give you one more example. I went down to Patong for Songkhram, and I was on the bus as we were traveling from the airport down to Patong, and this guy here standing next to me was a pilot, and he's talking to some other people. What he does from Switzerland, he comes and picks up patients that need to be flown back to Switzerland for care. It could be a bad accident, it could be something bad, I don't know, a massive heart attack, but that's his job, is to fly people back to Switzerland. They have a program where if something happens in another country, they will fly you back to the country for health care. So what would happen to you if you had to be flown back? I personally think for Switzerland, it's probably because of the coverage, that they're covered for certain things there, so it's better to get covered in Switzerland. But here in Thailand has some of the best hospitals in the world, so it's world-class care, so that part you don't have to worry about. But ask yourself these questions while you plan not just your itinerary for when you get here, but also worst case scenario, what are you going to do if something happens? So my health insurance journey started with me getting travel insurance with Safety Wing. Now, Safety Wing is not a sponsor, but Safety Wing, if you want to sponsor me, I'm available. So Safety Wing is not a sponsor, but I really want to have some kind of coverage in case an accident or something happened, I would be covered. But I carried that from the United States to Vietnam, where we stopped over, and I had it for a while here in Chiang Mai, and I decided to get comprehensive coverage. That's coverage moving forward for things. Now, what I didn't want is, I didn't want to have just everything. I don't need doctor visits paid, covered. I can do that myself. But what was my concern is those accidents that can happen, the big C word, cancer. What about a heart attack? Anything that can put me in the hospital for a stay, that is what I wanted covered. So I watched a video by Narrow Gate. He has a YouTube channel here in Chiang Mai, and he interviewed a insurance agent from Pacific Cross. And so I started doing my research on Pacific Cross. They have a very good reputation. I talked to 3 people that have used their services, and they said they had no problem with them paying out, so they had a good reputation when it came to that. So I reached out to him, and he sent me a medical questionnaire for my wife and I to fill out. We filled that out, we sent it back to him. Neither one of us have any pre-existing conditions that we had to be concerned about right away. And so once we sent the questionnaire back, he sent an offer which included the cost of it, and I thought it was pretty reasonable. So I'm going to change locations. I'm here at this restaurant, but it's getting crowded and I don't want to hold up a seat or anything. But I will see you back on the computer. I will go over the numbers with you, and I will go over on what's covered and why it's so different than what I would have been paying in the United States. I'll see you back at the house. All right, so let's talk about my health insurance, me and my wife. And so after the agent went over the questionnaire, he saw what we were looking for as far as coverage. He came back with what he thought would be the best plan for us, and that would be the Maxima plan. And so what I'm going to do is I'm going to go over the Maxima plan, kind of let you know what it covers, and then I'm going to talk to you about the cost, what we paid for it. So on the left of my screen over here, where the mouse is going around here, that's the Maxima plan, that's the Maxima Plus plan. So for hospital choices, that's one of the things that really caught my attention, because there's really, there's no limit on hospital choices. And I want to say there's 450 hospitals that they cover here in Thailand, I believe. And emergency medical evacuation service, worldwide evacuation. That's good to have, but like I mentioned earlier, I truly believe that that Thailand has some of the best healthcare, and so that won't be a problem getting any kind of healthcare here, as far as I'm concerned. The maximum limit per disability per policy year is 5 million Thai baht. And if you look at the cost of some things over here, 5 million Thai baht is a lot. I think that's going to cover pretty much everything. So when we talk about the inpatient benefits, the room, board, nursing charge, other medical charges, maximum of 8,000 baht a day. Now that might not seem like a lot, but when I was looking through this, I came across this right here. So this is Bangkok Hospital down in Hua Hin, and that's a standard room right there. And Bangkok Hospital is going to be one of your more expensive hospitals to go into. But as you can see there, the room rate, and then the nursing fee, the hospital fee, meals, that comes about 7,500, 7,510 baht. So the coverage is pretty good when it comes to rooms. And then I'll get into, as far as ICU, that kind of stuff. Here we go, right here. Intensive care unit and coronary care unit, normal and customary charge. So what I mean there is that what is normal and customary for this region? So in Chiang Mai, what is the normal and customary charge? That's what they will cover. The operating theater, the operating room, same thing. Same thing with surgical fees, the pre-surgical assessment, etc. you can see that this gets pretty comprehensive as we talk about having inpatient care. Organ transplant fee for liver, heart, lungs, kidneys, bone marrow, kidney dialysis, including donors, costs 1 million Thai baht. And believe it or not, that will go a long way when we're talking about that. I guess the anesthesiologist, that fee, whatever, is normal and customary charge as well. So say there's an accident, maybe there's some physical therapy, some rehab afterwards where you need a nurse. That private nurse fee recommended by a physician, up to 30 days. So that's pretty good coverage also. The inpatient psychiatric mental disorder, 50,000 disability, 200,000 lifetime. So, but you know, a lot of the fees that hit you back in the Western countries, you know, if you were to itemize a bill, the diagnostic laboratory fees, the x-rays, prescribed medicines, blood and plasma, water, wheelchairs, rentals, surgical appliances and devices, you know, that's stuff that's going to be covered under those normal and customary charge. Also, permanent implanted medical devices and artificial organs. And I think about, you know, I have had hip replacement, and so we're talking 300,000 baht. The hip replacement won't be close to that amount right there over here if I was to have had that surgery over here. But I got a whole nother video coming out about that. But physician's daily hospital visit, same thing, normal and customary care. And so it's kind of like the customer profile, ideal plan for non-professional sports people, individuals, include motorcycle riders and families after a low-cost plan with a wide range of benefits. Those things right there, that pretty much covers, you know, a lot of the stuff, anything that I'm going to need covered, you know, is going to be part of that Maxima plan. So what about costs? Well, let's go back to mention in the United States, and the plan that I had with my employee. If I was to keep my insurance through the state of Florida, it would cost myself and my wife. Are you sitting down? It would have cost myself and my wife $1,300 per month. So that would have been painful. As far as, and really, here's the thing, I would have still had to probably work part-time just to cover the insurance over there. So yeah, so what do I pay for this right here? So we got the acceptance letter back from the insurance agent, and I'm going to take a look at my notes so I get the numbers right. So my wife, for the year, her coverage was 44,027 baht. 44,027 baht. Mine was 38,367 baht. So what really helped me is that my age, because I was about to turn 55 when we got this plan, and so that's the rate I got based on that. And so what are we talking about as far as total? We're talking about $2,259.72 for the year. Now remember what I said, that it would have cost for just me and my wife would have been $1,300, you know, per month. And so if I was to take that times, divide that by 12, we're looking at $188.31 per month. So that's what our insurance cost is. That's what it's covered. But I want to leave you with this. And also, before I wrap this up, down in the comments, I know some of you may choose to what they call self-insure, where you don't have insurance, but you have a savings account. So if any of you are over here in Thailand or anywhere else living, you know, and you decided just to self-insure, let me know down in the comments. Let's have that conversation. And I will say this right here. I almost didn't get insurance because, you know, the 26 years that I worked for my agency, I was in a hospital twice for hip replacement. But all that money, you know, that I was paying out, and I had accidental insurance, and I never really used any of that. I'm In my head, I'm going, man, that's a lot of money to pay out and never use it. So I said to myself, what if I just put away $300 a month and save that up? And what if nothing happens for 10 years? I have that. But the bottom line is anything can happen at any time, and it does. And I'm 56 right now. And so, the older I get, unfortunately, this is how it works. The more you see people that you know pass away. And we're not talking about people in their 80s and 90s. We're talking about people that I've watched my age get diagnosed with cancer. And so you never know. And so I used to be this invincible person where I didn't worry about that kind of stuff. But now, just a common sense approach to having some kind of coverage. I know not everyone can afford it, but it's important because anything can happen at any time. All right, so I'm going to take you outside. I have some final thoughts, and I will wrap it up. I'll see you outside. So one of the things that I liked about my plan also is that I will have coverage, I want to say up to 99, renewal up to 99 years of age. I think that's what's in the policy there. But one of the things I want to talk to you about, depending on when you come over, I have an expat group my wife and I, we go to, and some of these folks have been here for 20 and 30 years. And one of the things they wanted me to let you know in this video that if you come over here after 70, it's going to be almost impossible to get any kind of real health insurance. You may be able to get just what you need to get your visa, to go that route. But so the sooner the better. I was 55, about to turn 56, so that helped me out. So if you've got any value from this video, please like and subscribe if you haven't. And I love you, and I will see you in the next one.